Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine presented by the Virginia Institute for Public Policy. My name is Joe Thomas, and our first guest this Father's Day weekend is Sally Pipes from the Pacific Research Institute, and how we're going to continue to fight this explosion in costs and shrinking availability of care. Sally, welcome back to the program. How are you doing today?
Thank you, Joe. Glad to be back and chatting with you, and on the Happy Father's Day weekend.
We had this come up during primaries this past week, that those in Virginia that supported the idea of Medicaid expansion. I want to get into your piece about some actions President Trump has taken that might help us. But the argument was, well, we're just not there yet to really understand how great it is that everyone's been given this access to Medicaid. But what we've seen in actual action has been people predictably having longer waits to get care, finding out that their copays were much higher than they expected them to be, having their credit scores dashed because now all of a sudden they had these massive medical bills that they didn't expect. Medicaid expansion in Virginia, just like so many other places in the country, has been a disaster, yet those who supported it still go around saying, look at how great I was. I expanded Medicaid for you all. Why are you not lining up to parade for me, Sally? How do they? Is it just some hypnosis they're in, or do they just not notice or not care?
Well, I think politicians, and particularly those of the more liberal persuasion, love the idea of government getting more and more involved in our healthcare system. And as we're seeing right now in the race for the Democratic nomination for president, the big push for single payer or Medicare for all among many of the 24 candidates who are in that race, and the others, well, maybe not supporting Medicare for all, they're supporting stepping stone approaches to Medicare for all through, a Medicaid buy-in, a Medicare buy-in at 50, all of these different types of public options. But on the Medicaid side, I think, and when Obamacare came into being back on March 23rd, 2010, it was signed into law by President Obama. The Medicaid expansion was supposed to have been compulsory, but of course, as we know in the 2012 U.S. Supreme Court decision, it was a bad ruling in the sense that Obamacare was not repealed. Mm-hmm. They did say that states couldn't be forced to expand their Medicaid programs, but as you know, so many states now have expanded their Medicaid programs. Some have done it through initiative, but I think it's partly liberal politicians want to see government being more in charge of Americans' health care rather than letting the market work. And you're right. I mean, so many of the states, of the 30-some states that expanded, the problem is that a lot of these people say, well, yes, we have medical coverage, but they can't access it because so many doctors are not taking Medicaid patients because the reimbursement rates are close to 40% below what they get paid, and the fact that in some cases the waiting lists are too long for those people who are trying to get on. So this Medicaid expansion is costly for states, as you know, because the Fed's full 100% funding of the expansion program for a while, is cutting back. Yep. Plus the fact that the whole idea is, Joe, of the work requirements. A judge in Washington said that's illegal, but fortunately, states that want to do work requirements are moving forward with it, regardless of that judge's decision.
It's a mess, but I think it's, as we said, Sally, 7 years ago with the creation of Obamacare, is seemingly more and more obviously designed to crash the system and leave us with no option more than VA for all, is what I've been calling it. Is we'll all get the same care our veterans are, and maybe with the same outcomes. Sadly,
yes.
You wrote a wonderful column, and now we have the next president in line who's trying to do something about healthcare costs and healthcare access. And instead of doing something proactive, he's doing something retractive. If I read what you're doing, what you're saying here correctly, instead of creating something new, he's actually taking away something that allows hospitals and insurance companies to hide what they're negotiating as far as cost Pascoe, explain what President Trump may do with this executive order.
Yes, this executive order, I thought that it was going to, they had said it would be released just before he made his trip to England and then on to Normandy, but it hasn't come down yet. But apparently it is going to come down, and what the president is going to do under this executive order is to require insurers and hospitals to disclose the prices that they have negotiated for services or various services. And he's hoping that transparency, of course, which is a good idea, will increase competition in the healthcare markets and drive down healthcare spending. Mm-hmm. I personally, and I'm sure, Joe, you do too, I don't support government trying to mandate what hospitals and insurers should do. But I think there is something to be said for at least bringing this to the fore and putting people on notice that we need transparency in healthcare pricing, just like in every other aspect of our life, whether it's our phone service, our bank service, whatever.
Well, I think in terms of this, I don't think he's forcing, as far as I read it, he's just saying you have to tell the consumer what you've agreed to as far as a price goes, rather than going to a grocery store, let's say, and you see a loaf of Pepperidge Farm bread and it's $25 and you think, oh, those greedy bastards at Pepperidge Farm, when really Pepperidge Farm just charged the grocery store $5 for the loaf of bread and the rest is grocery store markup under a brand name. And I'm just using please, if you know anyone at Pepperidge Farm, that I'm not demeaning them specifically. I just pulled their name out of a memory bank of mine.
Exactly.
But this way, you know who's charging who and who's going after what, and maybe shop for a better alternative.
Right, and we've seen that, with CalPERS in California, where there's 1.3 million current and retired state employees, and CalPERS, identified 41 hospitals in the state that could provide quality knee and hip replacements for $30,000, and supposedly they're just as good. But that reduced the cost of knee and hip replacements. Some places charge up to $100,000. But I think if we can get transparency, and this is one of the great things about health savings accounts. People that have HSAs are much more likely to shop around. The problem is, when you're told you need a hernia repair and you call up the hospital that your doctor has said you should probably go to, they're like flummoxed. They have no idea what the cost will be. But I really think that transparency will help to bring down the cost and help consumers and patients, shop around and find out what, what is the best price at the best quality. Of course, is also important. You don't want to go to somebody who's, backstreet butcher, but.
Well, and that's one of the worries when the government gets involved in these things. It becomes just like an electric utility. Who's the assigned medical provider in this area? Who's the assigned electric company in this area? And then, the government will regulate the costs. We see how well that works once the electric companies start, paying big sums of money to political leaders' re-election campaigns, and then they say, we need a 10% rate increase. Oh, yeah, absolutely. Go ahead. And even if it's not collusive, there's that image of, just cronyism that I don't think helps anyone, and certainly wouldn't help anyone in a medical profession where often you don't have two or three choices in a town. Charlottesville, where we come from, we're blessed to have two relatively high-class, well-renowned hospitals literally about 5 miles from each other, where, there are areas of this country that would give their left municipal arm to have one hospital like either Centara, Martha Jefferson, or UVA Medical Center. So, a lot of places you can't just shop around, so you need to be able to find that place and go there.
Right, exactly. And, if Bernie Sanders, it's unclear at this point, who will be the Democratic nominee for president. But if it is Bernie Sanders, he's going to be pushing for Medicare for all. And, of course, if that's the case, government will be running the whole show. And there will be no price transparency at all, as we know in countries like Canada and the UK, where the government is the sole provider. You don't know what the cost is, but there is a cost in terms of new taxes, increased taxes, but also waiting lists and ration care. And that would happen in this country just like it has in those countries. And these ration care and wait times would grow over time as government finds that the demand for health care is much greater than they ever anticipated.
Well, that's one of the problems with the concept of Medicaid for all. I happen to be watching an old episode of The West Wing, and Jimmy Smits was debating Alan Alda for the presidency, and there's a thought there. They were talking, and he was talking about how great and efficient Medicaid was. And I remember those arguments being, well, look at how efficient this, but it was such a small, and when you pencil it out to the entire population, that efficiency goes right out the window that everyone flaunted in the 90s. As we go to 2020, could a Kevin McCarthy speakership or a Jim Jordan speakership lead to an actual real repeal and replace, and maybe opening up HSAs and lifting the requirements that we divest them and things like that?
Well, I mean, that is my long-term goal. As you know, and Joe, we've been talking about this for several years. Let's hope so. As Mitch McConnell said just the other day, they're not going to be talking about repeal and replace between now and the 2020 election. But, I mean, the Republicans need to get their act together and, come up with a plan like Dr. Tom Price, when he was in the House, did, allowing people to people in the individual market to write off the cost of their health care, just like those of us who have employer-based coverage. There's so many things that can be done. And I think the American people, when you look at the polls that show from Gallup and Kaiser saying that, 56% of Americans support single payer, or Medicare for all. But then when you ask them, well, what do you think about it when your taxes are going to increase, or that you're going to lose your employer-sponsored coverage, which about 180 million Americans have today, that support drops down to 37%. People don't really understand what Medicare for all is, but the American people like choice, and therefore we want, but if Mr. Trump wins re-election and the Republicans take back the House and keep the Senate, I think they're going to have to act very quickly to do a repeal and replacement of Obamacare and come up with ideas that can pass and will actually open up the market for all Americans and it'll help reduce the cost. But I don't know about what you think, but boy, we're a long way from the 2020 election. There's going to be a lot of battling going on.
Well, and more people waiting longer and longer for health care and deciding that, quote, the system is bad, because the media has done a good job of spinning it as Donald Trump's fault, not Obamacare's fault or anything of that nature. So we need to keep ringing that klaxon bell that this has been made better, not worse, from it. Sally, in what you see and what you hear, it sounds like you would like this to be a campaign issue, but the American people, when they start to get comfortable with something and they feel like, all right, well, this is the new normal. I feel like that's sort of what's happened with Obamacare. We've got worse outcomes, but people are shrugging it off and saying, well, it isn't so bad. I worry that we've settled. Have you felt the same thing at the Pacific Research Institute?
Well, I think definitely the mainstream media is really pushing Medicare for all. And people like Nancy Pelosi, who is not pushing Medicare for all, surprisingly, but she is pushing building on Obamacare and the public option. I think it's, the American people have become kind of complacent, even though with Obamacare the premiums are too high, small networks of doctors and hospitals. But it's our job, Joe, to educate the American people on why, I still believe Obamacare or these stepping stone approaches, the public options, Medicaid buy-in, Medicare buy-in, they're all stepping stones to single payer. Yeah. So we have to educate the American people on why this kind of thing is not in the best interest of their health care. And I do think that it is going to be the number one domestic policy issue in the 2020 election. Trump won in 2016 based on saying we're going to repeal and replace Obamacare. They couldn't do it, as you know. But I think, they're going to have to act quickly and be very decisive on this for the 2020 if they want to win the election.
We've watched the pandering wild far left do a number on a lot of Virginia Democrats in the past election. Is this going to continue to be a fight in primaries in the Democratic Party, especially as we go into 2020, do you think, outside of necessarily the Medicaid realm, but it is one of the planks of that, grand socialist scheme is everyone should be able to just walk into a doctor's office and say, treat me because I'm a citizen. This has become blood sport between old school Democrats. And as you said, even Nancy Pelosi is out there saying, whoa, what are you guys talking about? How are we going to pay for this? But the pandering is just getting crazy.
Well, exactly. And so many of the blue states, such as, Washington State, the governor, Mr. Jay Inslee, of course, who has signed a public option bill in the state of Washington. He's running for the nomination. A number of states are going to be really battling. The Democrats are going to be really pushing for Medicare for all, public options. And so it's going to be a huge battle. And the old line Democrats, as we've talked about, Nancy Pelosi, et cetera, they're not so sure. They've been around a long time. They know what these government programs are going to cost. So, but if you look at here in the state of California, Governor Newsom is the budget will probably has to be passed by Saturday, June 15th. And in there is a expansion of Medi-Cal, the state's Medicaid program, for illegal immigrants. And so under it, up to the age of 26, illegal immigrants are going to be able to get health care, they say, at a cost of $98 million for 90,000 lower-income illegal immigrants. So California will be the first state in the nation to do this, and it'll probably, once it happens, and you'll see many of the other blue states, I don't know about Virginia, but they'll be saying, well, we better provide coverage for our illegals. And therefore, we know what that means, that the tax-paying public, those people who create jobs, taxpayers, are going to have to pay to subsidize people who are here illegally.
It's absolutely stunning that we're still going down this road. But once you start pandering, I guess you just can't stop. It's like eating
the
Reese's
disease.
Peanuts or the potato chip. Bet you can't eat just one. Sally Pipes, Pacific Research Institute, and visit, read, and download and appreciate at pacificresearch.org. Thank you so much for your visit this week.
Thank you, Joe, and happy Father's Day.
Thank you very much. And one of these days, we're going to be able to call Sally and say, hey, Sally, medical care has been fixed. What do you want to talk about this week?
Well, then I can retire and enjoy myself, lie on my chaise lounge.
Yeah, well, you've got a beautiful part of the country, despite its crazy politics out there. We appreciate it, Sally. Thank you so much.
Thanks, Joe. Bye.
Coming up next, the great Brent Bozell unmasked, his new book on the media and its attack on the president. And then we'll be visited by Pete Snyder of Disruptor Capital and the back hallways of the Republican Party of Virginia, breaking down not just the Republican but also the Democratic primaries this week on Freedom and Prosperity Radio.